A national health alert warning doctors about a respiratory virus that appears to cause muscle weakness or even paralysis in some children. Here to answer your questions about that is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Good to see you, doctor. Thanks for being with us.
My pleasure.
All right, let's talk about these symptoms because they sound kind of scary here. What do parents need to know about it?
Well, the first thing is that this is not a new disease. This is not something that we have to learn how to spell or where it came from or what it actually is, because we've been dealing with this type of virus. It's called an enterovirus for many, many years. It is a virus that can generally cause respiratory diseases in children, typically in young children. And most of the time, it is a benign illness that responds to supportive measures and just loving care without any long-term complications. But in rare instances, and in particular with one type of these viruses, so-called D68, you can actually have some very rare but very concerning problems, such as limb paralysis, where the lower extremities, the legs, for example, become very weak.
Which is so scary for parents. The CDC is saying that the number of patients may increase in the next few weeks. Are you aware of any cases yet in the Boston area?
I'm not aware of any cases yet. It would not be unusual, unfortunately, for us to start seeing some of these cases because these viruses, unfortunately, tend to circulate in the late summer and fall, which is the period we're in now. At the same time, I think one of the reasons why the CDC is alerting us to this is because, as you know, with all the masking measures and the attempts to sort of prevent people from being too close to one another, we have probably spared children and adults these viruses for a couple of years. And now people may have become a little bit less resistant to these viruses because we haven't seen them for a couple of years since we were isolating from each other.
Makes sense. I also want to ask you about flu shots. Some experts believe the season's going to start earlier this year. What's the best time for parents to schedule them for their kids?
It's a very interesting and difficult question. In general, we would say probably before the end of October. And the reason why we say end of October is that in general, we don't start seeing influenza cases in the US, particularly in the eastern seaboard, until December. And so you're giving time for people to get their vaccines and to mount an immune response. But with COVID, and as we've seen in the southern hemisphere, where influenza outbreaks are in their winter, which is our summer, the flu epidemics this year have started a little bit earlier. And so we're a little bit worried that maybe this year flu will start before December, which is why I think getting vaccinated before the end of October is a good idea.
Doctor, kids as young as 12 are eligible for the new COVID-19 booster. Can they get that shot with their flu shot? Same arm okay? Do they need to go into different arms? And do you recommend this happening at the same time?
It can certainly happen at the same time. That is not a contraindication. You can get your flu shot and your COVID shot at the same time, even for kids 12 years and older. The one issue that we try to do, if we can, is we give them in separate arms so that the child doesn't have two arms that are, one arm that is particularly sore, and you can sort of spread it out a little bit. If for whatever reason the parent prefers or the child prefers or another reason that that comes up that you don't want to give one shot in one arm and the other one in the other, then the CDC recommends giving the two injections at least 1 inch apart. And that's something that is done routinely with many vaccines for children and adults.
All right, Dr. Malley, we appreciate your time and your insight.
Thank you, doctor. Stay well.